It's just such a dreadful death.
We are seeing it left, right and centre in Durban.
And the virus, like you say, stays very stable in that environment.
It stays in the environment. So
So
it's not one of those viruses that's passed out from a sick puppy and then dies. There's very few antiviral detergents that can kill that virus. If you pick it up early, the chances of treating the puppy and bringing it through are so much greater than when the puppy is so ill and so dehydrated that it's then fighting very often a losing battle.
welcome to the Pause and Effect podcast. I'm your host, Dr. Kara, and today I have a very special guest, Dr. Reddy. You don't mind me calling you by your first name?
Not at
Risha?
all. Yeah.
Okay. So you are a very experienced veterinarian, and we were talking just off air about some of the common things we see. I mean, common things are common. And one of the top things, one of the most common complaints pet owners have is their pets having a digestive upset. So vomiting or diarrhea. You see it a lot, don't you?
Oh, very commonly. It's
Yeah.
one of the most frequent things we see in day-to-day practice.
And sometimes it's and we'll go into the whole topic in quite a bit of detail, hopefully, but sometimes it's fairly self-limiting, but there are times that the delay in seeking attention or understanding when to seek attention can result in quite severe consequences.
It can, yes.
So let's start by saying, does vomiting and diarrhea often happen together? What is it? Let's start by unpacking.
So it depends on the cause of what caused the vomiting. So it's most commonly caused by a dog or a cat that ate something that they found that irritates the stomach lining, and that can cause a bit of vomiting.
Okay.
If it gets further into the digestive tract and affects the gut, then there'll be some diarrhea as well. Okay. So it depends what caused it, what the dog or cat ate. Was there a change in their normal diet? Or did they get maybe access to the garbage bins, which happens from time to time?
Yeah.
That can very commonly cause a bit of a vomit, which can be self-limiting. But if they get access to things like bones or very fatty foods, then that can get more serious.
And those are because they cause other conditions that show up as vomiting and diarrhea. So can we start by listing some examples? I mean, I know that the list is, you can't go through every single possible differential diagnosis for vomiting or diarrhea. But what are some of you said obviously eating something that they shouldn't, whether if it upsets their stomach, eating sort of some bones that may lodge, is that correct? You're worried about foreign bodies.
We're worried about foreign bodies. So sometimes owners do give their dogs bones, which can cause a whole host of problems. And as a vet, we never recommend giving your dogs bones. There are many safe chew toys that will give the same level of enjoyment, but without the risk of bones causing obstructions or even irritating that digestive lining as it passes through. So best case scenario would be that it passes through, but it can scrape and cause some enteritis or gastritis, and that will cause discomfort and vomiting. But worst case scenario is when that bone can actually get lodged and can't pass out of the tummy, or passes out of the tummy and actually gets stuck in the coils of the guts. Wow. There was one Jack Russell that I once saw that had a lump on its neck, and we had to do some surgery to find out what was happened. And it actually had eaten a chicken wishbone, and the wishbone had gotten through the inside of the throat and stuck through the muscle and caused an abscess.
Wow.
And then when we kind of dug through and found what was the cause, we found that wishbone and removed the whole thing. So, can cause a lot of problems.
Some severe
those
stuff. So not
bones.
even necessarily associating feeding bones with something digestive. It can even lodge and cause obstruction higher up.
It can cause an obstruction
Absolutely.
higher up.
And I mean, for people who say, "Oh, but I've fed bones for all of,"
But then
my
you're
pets.
playing Russian roulette, because nothing can go wrong for a while. But when something does go wrong, it can be so serious that you don't want to gamble with your pet's health. So rather not feed any bones.
I use the example where I'm like, well, I've been driving for so long and I haven't had a severe accident. It's the same thing. It's always possible. And, you've got to try and mitigate those kind of risks. So you were talking, the other thing you mentioned was feeding fatty foods. What are some of the conditions? I mean, we obviously talking about things like dietary indiscretions, eating rubbish. And
So unfortunately, dogs and cats can be very sensitive to fat content in food. And there's a specific organ in the body called the pancreas. And that pancreas can get very inflamed very quickly. So a typical history would be people who have a braai on the weekend and then they have some fatty leftovers, and either they deliberately feed those fatty leftovers to the pets, or the naughty pets can smell the tasty leftovers and find it in the garbage bins, which will lead to a condition called pancreatitis. Now, pancreatitis is more severe than just a stomach lining inflammation or a gut lining inflammation. That pancreas is a very sensitive organ, and that will cause severe discomfort and pain. The dog will be hunched over and often causes vomiting and sometimes diarrhea. In that case, if your dog or cat has had a history of eating something more fatty than it's used to, and it is vomiting and it is in discomfort, you should then get your pet to a vet as soon as possible, because that always will need some treatment.
No, and it's incredibly, like you say, incredibly painful for
very painful.
I don't think people sort of understand. And I think, going and delaying our further discussion on it, I always surprised, a bit like when we spoke about bee stings in one of our previous podcasts and how painful that is. You look at the horses who colic. You look at children or babies who go through that colic phase, and that colic obviously being that severe discomfort.
Yes, yeah.
Generally, things like pancreatitis, but anything involving the gut is incredibly painful.
It's very painful.
It's really, really sore.
Unfortunately, some dogs are very stoic. So they might not eat and they might have a vomit. But as a vet, when you examine and you feel that tummy, it's so tense. The tummy walls are so hard and tense. And that's when you realize the level of discomfort and pain that the poor pet is in. So the owner doesn't always realize how sore that can be. It can be very sore.
And if you have access to them, I think the other fear is that things like cats can go and hide. And so you don't always even recognize some of the signs.
Yes.
And they can be suffering with a severe pancreatitis and they're hiding under the bed and you're not even aware. So terrible. So any vomiting evidence or diarrhea needs to be investigated further,
100%,
is what you're saying.
Yes.
So in terms of vomiting and diarrhea, like we said, the list goes on and on. But what are some of the other possible causes that are
So
more
let's look at
generalized?
Puppies.
Yes.
Puppies have a very, very serious virus called Parvovirus. It's something that we vaccinate against, but unfortunately, people can either buy a puppy or that is not vaccinated, and there might be a delay before they get to the vet and get it vaccinated. So if they develop this virus, it causes unstoppable vomiting and very bloody diarrhea. This virus is everywhere in the environment. So a puppy that's not vaccinated, especially the full course of vaccinations from 6 weeks onwards, they're very sensitive to picking up the virus. It is everywhere. So you might not think about it because you can't see it, but you are driving in your car and you're going into the rest of the world and meeting other people, and this virus is everywhere. So you could easily bring it back home without realizing it to your puppy. Unfortunately, it can be a life-threatening condition. Vets can try their hardest to treat this disease, and we can hospitalize the puppy, and it's often a life or death fight with this virus.
That's a bit of a journey, isn't it?
It is a huge journey. It is completely preventable through vaccination. So that's something that has to be done. Unfortunately, people can get lax sometimes and maybe delay it a bit. But again, I've seen so many parvovirus cases, even in the last year. Normal thinking is, as time passes, more and more people vaccinate and we shouldn't see it. We are seeing it left, right, and center in Durban. Not far away, not only in the rural areas, but in Durban. And they're keeping the virus in the environment all the time.
And the virus, like you say, stays very stable in that environment.
It stays in the environment.
So
it's not one of those viruses that's passed out from a sick puppy and then dies. It lives in that environment. There's very few antiviral detergents that can kill that virus. So it stays in the environment, and that's why puppies are so sensitive to picking it up so easily. So yes, if you have a puppy that has vomited or has diarrhea, even if it has had 1 or 2 vaccinations, it's imperative to get that puppy to the vet as soon as possible to be tested for that virus. Because if you pick it up early, the chances of treating the puppy and bringing it through are so much greater than when the puppy is so ill and so dehydrated that it's then fighting, very often a losing battle.
Yeah, and it's just such a dreadful death.
It's a very dreadful virus.
So obviously we worry about our young patients. What about our very elderly patients that...
So in elderly patients, it could be the common causes of vomiting would be organ failure. So kidney disease is very high up on that list. Oh, beg your pardon. And then there's also dietary indiscretions. As pets get older, sometimes they have dental disease or their appetites wane for various reasons. And owners are very tempted to then try a bit of chicken skin or something that is maybe not the usual part of the diet. But it is best to get your vet to check over your geriatric animal every 6 to 12 months so that if there are signs of, excessive water intake or dental disease or organ failure or weight loss, there are things that we can do to pick up these diseases before it gets to the stage where your dog is vomiting. So these geriatric screenings are very, very important.
Absolutely. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Before we continue, let's address a critical aspect of feline health, weight management. Allow me to introduce you to UltraPet's special diet, Metabolite cat weight loss food. It is available in 2 kg and 4 kg packs, specially crafted to support your cat's well-being and vitality. This recipe isn't just about reducing weight, it's about promoting healthy weight and management. With 34% protein, 11% fat, and 4% fiber, it helps control lean muscle mass while maintaining a healthy weight, ensuring optimal nutrient absorption. Featuring a tantalizing chicken and rice flavor, UltraPet ensures that even the picky eaters will enjoy their meals. The vacuum-coated kibbles deliver a taste experience that your cats will love. What sets this weight loss food apart is its formulation made with fresh meat, providing a healthier source of protein. Plus, the added addition of taurine supports good eyesight development and a healthy cardiac activity. With omega-6 and 3 fatty acids, this food promotes a shiny coat and a healthy skin. Additionally, the inclusion of VitaCat ensures essential vitamins and minerals for healthy development and immune system protection. The prebiotics in this formula create an environment for microflora to flourish, further supporting your cat's digestive health. UltraPet's special diet, Metabolite, is an ideal choice for overweight cats. Just ask Freya, my Bengal, who has thrived on this diet. Give it a try and see the difference for yourself. Your cats will thank you, and you'll appreciate UltraPet's commitment to feline health. Now, back to our episode. So, in terms of, you made mention obviously of the puppies with the Parvovirus. How frequently do you see this with worms? Is that a common
So
cause?
common.
Okay.
And it always surprises owners when I do a fecal test on a dog or puppy that comes in with diarrhea and there's worm eggs in the stool. The problem is that you don't always see adult visible worms in your dog's stool, but those eggs are microscopic and we pick them up on those fecal tests very, very commonly. Okay. It's very important to deworm your pet. It's one of the very, very common causes of vomiting and diarrhea in dogs because they're in the garden and they do pick up things in the garden and they scavenge and they chew grass and they are picking up worm eggs and worm larvae a lot. Specifically in Natal, our heat and humidity does predispose them to picking up a type of worm called hookworm. It's very common in Natal. And people sometimes only deworm their dog once a year with the annual vaccinations or once every 6 months. No, it's not enough. That hookworm stays in the environment, in the dog's poo, and then the little eggs hatch into larvae. Those larvae can go through the skin of the dog as they walk through your garden. And even if you as the owner walk barefoot, unfortunately those larvae can get into your skin and then cause a bit of a rash on your feet as well. Yeah. So deworming is very important. Hookworm is extremely prevalent in Natal. And it's an easy fix to deworm your dog once every 1 to 3 months. Mm-hmm. The exception would be if you are finding adult worms in the dog's stool, you would then want to be a bit more frequent. And you always want to make sure that you clean away that dog poop every day from the garden. as annoying as it can be to go out and trek through the garden and pick up, be on a detective hunt for dog poop, it's very important to remove that. Otherwise, the deworming is only 50% of the battle if you're leaving stool to accumulate in the garden.
Very good point. Very, very helpful. And in terms of, say you've got a dog that, for example, you put on medication. How frequently and what medication, just classes of medication, do you find can cause these sort of signs, vomiting and diarrhea?
So sometimes people want to self-medicate and they can use human medication in animals. There are some types of human medications that we can use in animals, but it's always best for the vet to decide which one, because vets are trained to know what is safe in dogs. Unfortunately, too many people will say, I tried one of my own human medications and it's not helpful. And then they come to the vet, which can be dangerous. So yes, there are a lot of non-steroidal anti-inflammatories that people use and they think it's safe for dogs to have. But specifically with non-steroidal anti-inflammatories, they can cause ulcers in dogs so much more easily. That's why for dogs, we have very specific non-steroidal anti-inflammatory drugs for dogs for pain and inflammation. So that's one class of drugs I would never use and take out of my human first aid kit and try on a dog.
Absolutely. So perhaps let's start then with, in terms of treatment strategies, what are the things that, before we talk about how we manage the cases, what are the things that owners can do when, say, they've just noticed that their dogs have started with a mild vomiting and diarrhea? Maybe they'll still eat. They're not refusing at the point of refusing food.
Right.
What are the things, if you get that phone call in the middle of the night and they're going, I just want to try and see whether I can manage this at home? What is your advice?
All right. So if the dog can keep food and water down and the dog is bright and alert and still running around and acting as normal, I would say, okay, give your dog 6 to 12 hours. And if it's not getting any better, if the vomiting or diarrhea persists, please phone and make your appointment with your vet. And if the dog has bounced back and is doing well, you can always phone and discuss it with your vet at a later stage. But it's always important to watch what's happening. Absolutely. So if your dog has a vomit and it's projectile, that's something I would say don't wait. Projectile vomiting can be a sign of something that's stuck inside. Not always a bone. Some naughty labbies especially love to eat things like socks or dish towels
or underwear.
Underwear, exactly. It can be quite embarrassing and entertaining to see what we can remove from a doggy's bowels. Sometimes they can still pass some watery stool, and that would make you think, well, if things can pass through, there's not a blockage. But there still can be a partial blockage or a complete blockage with a little bit of watery stool passing out. So if a dog has projectile vomiting, I would say don't watch, get to the vet. Okay. If a dog has blood in the stool, don't wait, get to the vet. So those are conditions I would say rather make that appointment as soon as you see it. But if it is a vomit, a once-off vomit, a once-off diarrhea, there's no blood in it, your dog is happy running around, eating and drinking, I would wait 6 to 12 hours and maybe just hold back on your normal food and just see what your dog is doing, and then make your decision to go to the vet. So
would you encourage them to offer a little bit of water or any bland
food? Water always. Or? I don't ever advise. That's just a human concept of. In dogs, we don't ever advise. We always have water, fresh, clean water available, always. Okay. And if it's keeping that water down, then we know that the dog probably has a good chance of recovering later on that day, and it's not too serious. But if your dog is getting quieter and quieter, refusing food, or is drinking water, and maybe even excessively, sometimes the water comes up, but your dog is just seems to not want to interact and is maybe getting quieter. The problem with dehydration in animals, it takes 12 hours to occur. So you might think, well, the dog vomited last night and this morning it's so quiet, but maybe it'll be fine. No, if your dog's habitus or behavior deteriorates and it's just getting quieter and listless and less energetic and less interactive, I would definitely then get it to the vet so we can check electrolytes and hydration status. if you have a dog that is sort of 10 kilograms or less, you need to watch it a bit more carefully, because just like human children, they dehydrate and they lose electrolytes so much more quickly than maybe a 20, 30, 40 kilogram dog that's had a once-off vomit or diarrhea.
So it's very proportional to their body size.
It is proportional to their body size. They can get weaker and have that electrolyte deficiency. We specifically look at potassium loss in dogs and cats quite closely.
Okay. And so you made mention of the hemorrhagic, the blood in the diarrhea. What is that telling you or owners? Why is there that urgency? What is the blood and where does it come from?
So if the gut lining is destroyed, so there could be a virus, a parasite. There's one called coccidia, which your normal dewormers do not cover, and that would need a specific treatment to treat that disease. It means that there is damage to the inside of the gut lining. So if you think of that gut like a hose pipe, the inside lining of that hose pipe is where all of your absorptive surface is. And if that's damaged either from a parasite, a virus, or a foreign body or something to that effect, maybe the dog did get hold of bones, that would all cause damage to the gut lining. Number one, that's going to cause a disturbance in your normal gut bacteria or microflora. It's going to cause quite a degree of pain and discomfort. It can lead to fever. And if that hose pipe is damaged, the normal bacteria in your gut can get into the rest of the bloodstream, and then you can get to serious consequences. So if there's blood in the stool, that a vet should definitely have a look at that dog and examine that dog for the underlying cause.
That's great advice. So when we have a dog that's come in and you taking a history and you determine, hang on a minute, this poor animal is really struggling, is at the point of requiring further treatment or at least admission for further workup. What is your general management strategy? What do you say to owners? Like, what is your plan of action for that pet?
So the approach to the case will depend on the history and the clinical signs when you're examining the dog. So if the owner says, the dog was fine and then we had a bit of bacon fat left over and then it had, that kind of leads me to feel the tummy more specifically in the right part of the abdomen where the pancreas would be. And if the dog is flinching and sore and tense, then I would say, listen, I really need to do some blood tests and an x-ray, possibly an ultrasound, and see what's going on here, because if your dog has pancreatitis, it's a very different scenario compared to if your dog ate a bit of grass and then threw it up and is just not feeling great, and that can be managed sometimes as an outpatient. If your dog rummaged through the bins and you had been eating chicken and you had thrown that carcass out and the dog has potentially eaten something like chicken bones or bones, I would then be more likely to take an x-ray. If you have a large breed dog that is restless and retching and panting and cannot settle, and sometimes has a bloated tummy, that is a huge emergency, and that needs to get to a vet as soon as possible, because your large breed dogs can get a dilated tummy, and we call it gastric dilation. If that tummy twists, and we call that volvulus, that animal is in a critical stage, and that needs to have an x-ray done immediately.
Yeah, this can't even wait an hour, can it?
It cannot wait an hour. So when I did emergency night work, I had many people who realized their dogs had bloated up, and by the time they got to me, unfortunately, some of those animals passed on in the car because of the shock that that condition causes. So that is a very serious emergency. It can happen in the medium and smaller breed dogs, but it's much more common in large and giant breed dogs. So possible causes would be eating too fast, or a sudden change of diet, and that gas accumulates in the tummy, or exercise after eating. The one case was where the father said, no, everything is the same. He just let his 5-year-old daughter feed the dog for a change. And I think she had lifted the bag and given the dog a bit of a feast that the dog's tummy wasn't used to. So the dog ate way too much too quickly and ended up with a gastric dilation and a volvulus. And often these cases require surgery to correct the twisting part of the tummy and to relieve all of the gas.
And sometimes to even empty all the contents. Hey?
Yes, so we try and empty the contents if it hasn't twisted already. And that is something that you can see very easily immediately on an x-ray.
Which is why this sort of investigation of all these things is so important.
Exactly.
That while you've got the opportunity to intervene.
Exactly. So in your deep-chested dogs like the German Shepherds and the Great Danes, you don't always appreciate that abdominal bloating because of the shape of the dog. But if there is a history of the dog restless and panting, sometimes foaming at the mouth or salivating, pawing at the ground sometimes, the first thing that we would then do after giving your dog a check from nose to tail is take it straight to that x-ray and shoot that x-ray and see what's going on.
Absolutely. And there's a lot of information that we are trained to recognize very quickly in order to...
So if you have a large breed or giant breed dog that you're worried about, I would say that's not something you can wait till the next morning. You need to contact your 24-hour vet at the time and take it straight through and say, I'm coming through, my dog looks like it's bloating, or I'm worried about my large breed dog. So that is something that you cannot wait, not even half an hour like you mentioned.
Yeah, so from what you've told me today, I think certainly the young, because they're small, young and small, the large deep-chested dogs that are predisposed to those, and then the hemorrhagic diarrheas. That
when
those are the
hemorrhagic
things
bloody
to
diarrhea,
not delay.
Not delay.
So let's take the best case scenario. Let's say, my dog's been vomiting. It's probably vomited about 5 or 6 times. I did, wait a bit. It's had a bout of diarrhea, and you take it through and you work it up. And fortunately, there's nothing
serious.
Nothing more than hopefully a vomiting and diarrhea. What's the main aim of the treatment that you then suggest or that you then put in place?
We have to stop that vomiting because we can't send your pet home with any oral medication if he's just going to vomit it up.
Okay.
So we want to correct the dehydration, stop the vomiting, and then we want to feed a diet that's been specifically made to ease that tummy lining, that's easily digestible, and then we put a dog on that for, depending on the case, a few days until its stool is nice and hard again, and then you can mix that in with its normal diet thereafter.
Amazing. And what is your feeling about the use either preventatively, so longer term, or in these sort of cases of using the probiotics or the things like medication that can help bind the stool? How effective do you find that, and how frequently do you give it as an over-the-counter medication or add it into your treatment regimes?
So if I found a specific reason, so there's a hookworm or coccidia or something that I can treat, and I know that once I've treated that, the dog's stool will be back to normal, I don't immediately reach for a probiotic. But in many cases, you don't always find an underlying cause, and you want that stool to get back to normal as soon as possible, in which case the probiotics are a very useful part of your treatment plan. Okay. Because it's something that you are replenishing the good bacteria that makes the stool hard in the first place, that the dog needs to digest the food. So it's always a good arsenal to have as home treatment as well. If your dog has a bit of a diarrhea and your dog is running around, and you give a bit of probiotic first, and you can just assess a few hours later and see
there's a response.
Exactly.
And how is it that the diets, say the therapeutic diets, the prescription diets, what is it about them that means it's better? Because obviously it looks the same. It's kibble. It's processed from most people's perception, but these are extruded foods. What is in them?
So it's a different kind of protein, carbohydrate, fat that's made in a way that the stomach and the guts can absorb and digest it. The salt levels and things like that would be normal in kibble is toned down because you don't want to irritate the lining of the stomach at all. So they've made it the type of protein that what we call a bland diet.
Okay.
It doesn't exacerbate any inflammation in the stomach lining or the gut lining at all, so that the body can heal from what it's going through, and the type of protein, the type of carbohydrate, the type of fats it's in the type of balance that the dog needs to recover.
So balanced yet bland.
Yes. not bland in terms of humans would describe bland as tasteless food.
Yeah.
Bland in terms of it doesn't cause any irritation of your gastric mucosa. So in a normal case, your normal dog food is fine for your guts to digest, but once your guts are a bit inflamed, it can't take the same type and quantity of proteins and fats, and it needs very adjusted levels in order to heal. In the same way as if a person has a bit of the runs, the mom would say, let's give some dry toasts and a bit of banana and things, because your normal diet will just be a bit inflammatory, a bit rich and pro-inflammatory. But on a normal case, those other foods would be fine.
Yeah. I think also from a not wanting to then vomit, sort of in terms of that richness.
Yes.
Not
it dials down that nausea level.
The nausea.
Yeah.
So overall, in terms of, I like the way in which you explained that vomiting is so critical, because until you can get them to a point where you can manage potentially the diarrhea, or at least allow them to want to eat, or the desire to eat, and keep it down, that nausea is often managed with injectable medication, isn't it? And the same, there is no ability to replenish the kind of losses we're talking about with vomiting and diarrhea but drinking. Is that right? So the fluid therapy
So fluid therapy is very important, and you'll often find that owners will say, no, the dog is drinking a lot of water, so it should be fine. But you can't orally take in enough water to replenish what's lost in fluids that are lost both orally and rectally. They lose not only fluids but electrolytes. So when we treat the dog for dehydration, we replenish those electrolytes in your bag of fluids that goes either intravenously and sometimes subcutaneously.
Absolutely. And I think, often, although some of the cases we've spoken about, they don't always, but things like a pancreatitis where they may have a fever associated with, also the losses that you get from sitting with a high temperature and dissipating that
it just
heat.
makes that whole dehydration cycle
Not wanting
worse.
to drink enough, not wanting to eat.
So your two cornerstones for pancreatitis would be the two P's: pain control and perfusion. And perfusion means it needs to be on IV fluids to perfuse that pancreatitis. So if you've got the pain under control and the IV fluids are perfusing, which means that the fluids are forcing blood through the pancreatitis, then it heals much quicker.
Absolutely.
And then a stint in hospital, and then they're home on a very, very strict low-fat diet for a while, sometimes lifelong.
Sometimes a permanent setup. Absolutely. So what would you say to owners? I know we're running out of time. I don't want to miss the opportunity to ask you anything that I think would add value to our conversation. But what would you say to owners who are reluctant because financially there are limitations to sort of managing things? They're scared to come into us because we're going to say we want to run bloods and we want to do a fecal sample, and these costs can often escalate.
So your best friend as a pet owner would be health insurance. If you make sure your pet is on health insurance, that takes that financial burden off having to be rushed to the vet either during the day or the night. Because if you don't have the funds to treat either your puppy for Parvovirus or your large breed dog for a gastric dilation and volvulus, those are very serious conditions that require such intensive therapy that you'd be very, very glad if it has been on a health insurance plan that then will help cover those costs. In all cases, if you're worried about your animal, at least take it to the vet for a consult so the vet can then determine, okay, I can give your dog some outpatient treatment, and then if it doesn't recover, you can always come back and then we can take it further.
Absolutely.
But that consultation for a vet to examine is very important, because the vet can then determine what's going on and what the dog needs. So it's not always a scary, huge thing. It can often be an injection to stop the vomiting, check if your dog has been dewormed recently, the correct diet for this situation, and then your dog can make a recovery.
Absolutely. And a discussion as to sort of what to do in the event that this is not working.
Exactly. And then what would be the next steps?
Absolutely. Yeah. No, this has been really informative. Thank you so much for all your time today. Thank you, Dr.
You're
Diarrhoea.
welcome. Good.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drkara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.